Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Your Health and Wellness Show. I'm Gouwah Solomon. Stay with me as we do another post-COVID show. This time, diabetes. Yes, there's been lots of talk of diabetes, diabetics having some questions around post-COVID, how diabetes has presented more during COVID time as well as after. And some people have sent some questions with regards to their conditions of how it's exacerbated, how it is deteriorated, and how they're possibly not even taking care of themselves when it was lockdown. But in studio, we have specialist physician and endocrinologist, Dr. Sajida Bulbulia. Assalamu alaikum to you, Dr. Sajida. Welcome.
Thanks for having me.
Shukran so much for making time. It's been a while and back and forth, but finally you're in studio with us. Welcome to Hilaal TV studios. I want to check in with you firstly with regards to the condition of diabetics and post-COVID. Where are they now and what was happening to them during the lockdown actually?
Okay, so during lockdown, a lot of patients with chronic conditions, our diabetics included, were not seeking medical help. As long as they were well, they were staying home. At least if you look at the data, about 20% of patients have either missed follow-up appointments with their doctors or missed collecting medication, solely because of lockdown itself, or they weren't allowed to go out of the house. They were scared to get COVID, issues of that sort. So a lot of our patients are presenting now with difficulty maintaining control of their diabetes, as well as requiring more insulin, some of them with complications that have arisen during this 2-year period. And those that have had COVID have struggled. COVID has impacted the treatment of diabetes in terms of requiring more medication, patients becoming sicker than other patients, requiring more hospital admission, more ICU admission, larger number of patients with diabetes dying from COVID as well than the general population.
What concerns did they show during COVID when during hard lockdown? Were you practicing or were just hospitals inundated with COVID patients? And what were happening with diabetes patients that had come in and presented with positive COVID cases?
So we were practicing throughout lockdown. I'm working in the public sector at the moment. Okay. So we worked right through lockdown. Our clinics were open, although we were trying as much as possible to limit contact with patients, especially our diabetics. Like we said, diabetes, a patient living with diabetes is not more likely to get COVID than anyone else, but is more likely to get severe COVID or long COVID than other patients, and require in-hospital management as opposed to home management, require ICU admission, have complications from COVID that other patients don't have. So we were seeing patients relatively quickly, maybe just offering them scripts because they didn't want to wait too long in the hospital. So a lot of things that we usually do for our diabetics, like screening for other comorbidities, for complications, was overlooked in this period, simply because we wanted the protection of having as little time in hospital as possible, for collecting the medication, for checkups. And then those patients that were admitted, like we say, more complicated course of admission, more prolonged course of admission. In addition to that, we saw a number of patients who were newly diagnosed with diabetes. So because of COVID and the inflammatory response with COVID, we saw a number of patients who had asymptomatic diabetes for a long time and suddenly presented because of this infection that pushed them into uncontrolled hyperglycemia or high glucose levels, which then showed up when we admitted them. And also there's the element of patients who developed, we may label transient diabetes during COVID, because of COVID. So there is the entity where COVID does affect your pancreas itself and the ability of the pancreas to produce insulin. And we have seen patients who looked diabetic, had severe hyperglycemia in hospital, were actually insulin requiring during their COVID time, their positive period with COVID during the admission, and then a few months down the line were off all medication, completely back to normal.
So they just presented with diabetic symptoms because of their positive case of COVID.
So yes, diabetic symptoms requiring insulin. So COVID and diabetes are quite intertwined.
Wow. So that's what we want to unpack as well.
Yes.
And get more information on.
There's a very bidirectional relationship between COVID and diabetes. Diabetes itself, like we said, diabetic patients are more likely to have severe disease, prolonged disease, to suffer from complications like renal failure or lung failure, respiratory distress, require admission to hospital or even ICU. And have a prolonged hospital stay compared to patients without diabetes. And then the diabetes control itself. So a patient who has good control of diabetes is more likely to have a better cause of illness than a patient with uncontrolled diabetes. Both type 1 and type 2 patients, we've seen that in.
You've mentioned asymptomatic diabetes. Transient, was it diabetes?
Okay, so,
just explain to us.
Okay, so asymptomatic. So remember, diabetes is silent, especially our type 2 diabetes, which we get as we get older, which we get if we have a family history and a genetic predisposition to diabetes. It has a long asymptomatic period. So you can be diabetic for 5, 10, even 15 years before you actually show symptoms of hyperglycemia, before you present to a doctor and require treatment. You can also be asymptomatic, completely asymptomatic, and have this diabetes diagnosed on a routine checkup by your GP or physician or something like an evaluation for medical insurance. From your routine health check, you can be picked up as a diabetic and have absolutely no symptoms of diabetes.
The transient diabetes.
So that's the normal diabetic. So normal type 2 diabetes can present, usually presents only after 5, 10 or 15 years after having hyperglycemia for that many years. And the issue with that is that already in that time, you're getting damage to your organs, your kidneys, your eyes, those kind of things. So a diabetic may present with complications. Some patients present for the first time with something like a heart attack or stroke, and then are diagnosed with diabetes. So because of the COVID, we were seeing these patients who would maybe have presented in 5 or 10 years' time. We were seeing them now, so what we called unmasking. So it's patients who had hyperglycemia at home but had absolutely no symptoms, maybe had a family history, wouldn't have been picked up as a diabetic unless they got ill or they went for some routine checkup and tested, or some screening procedure and were tested. So they had no symptoms of diabetes, but were then noted to be diabetic on admission for COVID.
But we'll find also in the general public just coming to visit maybe for a screening for another chronic condition, and then they'd pick up during hard lockdown, they couldn't go to the hospitals. They weren't picking up these conditions during normal screening. But now immediately post-COVID, they were coming to hospital and all of a sudden they'd find, is it because they had COVID or?
No, so a majority of these patients, so at least if we look at diabetes statistics, at least a third to half of patients remain undiagnosed. Like we said, because it's asymptomatic, type 2 diabetes usually is asymptomatic in the initial period. They don't get diagnosed until they have a complication or they have an illness or they go for some screening test for something else, insurance or medical aid or something like that. And then only they get picked up. So because then they got COVID and they got sick enough to be in hospital, they were diagnosed with diabetes. What I label transient is a different entity itself. Like I said, COVID itself can affect your pancreas and it decreases your insulin secretion. So again, in a patient who is already diabetic, so type 2 diabetes that is insulin resistant, more than insulin deficient, it can worsen the control of the diabetes. But in patients who have no history of diabetes, who have no symptoms prior to having COVID, may present like a diabetic, requiring treatment like a diabetic, and then within a few months completely recover and be off treatment.
Let's talk about what's happening in that person's body, because you've mentioned the pancreas and COVID having some sort of effect on the pancreas. Let's elaborate and understand that, inshallah.
Okay, so I'm not sure if you're aware, the way the COVID virus gets into the cells in the body is through the ACE receptors, the angiotensin converting enzyme receptors, and the pancreas, the insulin producing cells in the pancreas have these receptors as well.
Okay.
So the same way in which the virus gets into these receptors in the lungs and causes your hypoxia and your coughing and those kind of issues, it gets into the islet cells of the pancreas and it decreases insulin production. Causes some damage to the beta cells, which then decreases your insulin production. And because you have no insulin, then you have hypoglycemia. And then the COVID itself, because of the stress response, your body mounts, and then the medication that we give also may increase your risk of getting hypoglycemia. And so that's a compounded effect.
And these people that maybe didn't present with diabetes, that end up in hospital with now presenting diabetic symptoms and sort of exacerbated as well through COVID. And they were treated now with insulin. And you mentioned then later on, and all of a sudden is it because then the COVID then got better?
Yeah, so once they recover from COVID, the pancreas then recovers.
Okay.
And then if they didn't have underlying diabetes, they go back to normal. If they do have underlying diabetes, then the need for medication decreases post-COVID. So that's also another important aspect. Patients who have had their medication increased quite significantly if they've had COVID in the last 2 years may now, with increase in health, increase in activity, suddenly find that their glucose has gone in the opposite direction and have hypoglycemia instead of very high glucose, they have very low glucose, and which is also an issue that we need to be aware of and treat. So they need to maybe cut down on their medication as opposed to increase it.
We chat more to Dr. Sajida Bulbulia and check out the impacts COVID and diabetes, how that has affected our diabetic patients around here in South Africa. Dr. Sajida Bulbulia is a specialist physician as well as an endocrinologist. We chat more to her just after the short break. Stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day. Welcome back to Your Health and Wellness. I'm Gouwah Solomon, and we have specialist physician endocrinologist in studio with us to unpack the link between COVID-19 and diabetes. There has been people that has been presented with diabetics all of a sudden. Yes, maybe they've had it in their family history, but since after COVID, the diabetic conditions within the population has increased tremendously, and this has been chatted about one of our first post-COVID shows. Dr. Sajida, welcome back. Let's look at the care for diabetics, with regards to their medication, with regards to maybe them not even coming for screening since they've had COVID and they found, listen, I've been okay, I'm just continuing my medication. It could possibly be even a type 2 diabetes, the asymptomatic diabetes. So they've changed their lifestyle and they've been diagnosed maybe many years ago. So they feel okay. They've had COVID. Now it's post-COVID, and they're also probably still asymptomatic. If we can maybe just look at those diabetic patients and what is their protocol now after having COVID and now post-COVID going back to hospital or doctor's checks.
So I think all patients, regardless of what they think their control is or what they, if they haven't seen a doctor in the last 2 years, should make an appointment with their regular GP or physician, endocrinologist to actually get checked. Just a routine checkup to make sure, to see where they're at, to assess what medications they're on, whether they are working effectively or not, does anything need to be changed, and then to screen for target organ damage. So we usually, in our diabetics, do this once a year. In our type 2 diabetics, we start at diagnosis. Like I said, patients with type 2 diabetes can present with complications at diagnosis. And a patient who has been diagnosed with type 1 diabetes, we usually start after 5 years and then do screening yearly. And that involves just an eye check, a foot check, tests for kidney function, maybe a urine sample submitted to check the kidney function as well. And that's to screen for complications. Maybe an ECG to look at your heart, your heart rate. So those are things we do yearly in our diabetics to make sure that we pick up complications quickly. And if there isn't any complications, we can implement methods to prevent complications from occurring. So it's important that they make an appointment to see their doctor, and just to have the screening done for the year, and to then have a look at their medications and look at their control. A number of ways we look at control. We can do it if you're on oral medication. We use a blood test called the HbA1c, and maybe a fasting glucose. If you're on insulin, you should be checking your glucose at home. So we'd look at your diary as well in conjunction with the lab parameters, and then to look at control and see whether or not your medication is can be maintained at the dose you're taking, whether it needs to be increased, or like I said, sometimes if it has been increased after you've been ill with COVID, even sometimes when you've been at home, it may need to be decreased now that you back to your full active lifestyle. Your eating habits may be a bit different. You are working. You are well again. So
you're thinking, I'm okay.
Yeah,
and then
you're thinking you're okay, but again, like we said, hypoglycemia can be silent, but it still causes adverse events.
Let's talk about the symptoms, because people's like, no, I'm okay. And you're saying okay, even though they're sitting there, they're saying they're okay. But like you say, it is a silent condition, and we don't pick up on that little bits of information. I know often people say, I'm going to the toilets a lot, and they'll say, oh, you might be diabetic. So let's just go through some of the checklists of some people that didn't ever present and could need to.
Okay, so some of the symptoms you need to look out for if you're worried about diabetes, or if you have diabetes and your control may be worsening, is excessive thirst. So what we call polydipsia. You get very thirsty. You go to the toilet a lot, and especially go to the toilet overnight a lot.
Like it wakes you up at night.
It wakes you up at night, makes you go to the toilet. You're going to the toilet a lot of times during the day. You're drinking a lot of food, a lot of liquids. Especially these patients seem to crave cold drinks and sugary drinks, because even though their sugar is high, it's not being utilized. And the reason for going to the toilet a lot is because your body is trying to get rid of excess glucose by excreting it in the urine. So, and that brings with it a lot of water. So you go to the toilet a lot. If it's severe, you may even lose some weight. And I know a lot about type 2 diabetics.
Lose weight.
Are encouraged to lose weight. But if they start losing weight without trying, without actively dieting and exercising, that's worrying. So if they're losing weight without putting in the effort, then that's a worrying symptom for their control. And then things like blurry vision, recurrent infections, or infections that are not clearing up, wounds on their feet, like I said, deteriorating eyesight, vision, those kind of issues.
Okay, so we've established the reason why patients has presented and why COVID-19 has made diabetics condition even worse. But then there are people that are presenting with more diabetes post-COVID who didn't think that they had. Would that also be the reason, because of it affecting the pancreas, and they didn't necessarily end up in hospital as well?
Yeah, so like I said, it can unmask diabetes. The infection can unmask diabetes just because it makes your requirements for insulin higher and makes the insulin resistance more. So you become more resistant. And it's also, there's very little data at the moment, but there is data to show that COVID-19 may actually cause diabetes in the long run. So patients are showing up more, being diagnosed more. And I'm not sure if this is just because the COVID is actually causing diabetes, or it's because people are just more aware of their health and going for checkups more, and like we said, screening more for health checkups, and then we are picking up those patients that we wouldn't have picked up until complications arose.
Any research, international research that's been done with regards to the link between COVID-19 and diabetes?
So, like I said, very little research in terms of long-term data.
Okay.
We have research into how it affects COVID, how it affects diabetes control, like we said, how diabetes affects COVID in terms of the severity. But in terms of causing diabetes, very little data at the moment. And because it's only been a short time, we don't know the implication of how long this is going to last, whether it's a temporary thing, whether it's just, like I said, whether it is actually the COVID itself that's causing the diabetes, or it's just that people are so much more aware of their health and being healthy that they are going for checkups and being screened
Has
for
there
diabetes.
ever been a link between, just the normal common cold and the flu and diabetes? Because now COVID-19 is here to stay and it's going to be like the next flu.
Yeah, so there's a link between uncontrolled diabetes and recurrent infections, all types of infections.
Okay.
Flu, upper respiratory, lower respiratory tract infections. It's just in general, if your diabetes is uncontrolled, you have a higher risk of getting infections and a higher risk of having recurrent infections, having prolonged infections, having wounds that don't heal and become infected. And then the other risk factors that for prolonged infection and inflammation that go hand in hand with diabetes is obesity, cardiovascular disease. So these things cluster together, especially in our type 2 diabetics, and they may coexist in one person and increase the risk for infections even more.
So, Doctor, if you could just quickly expound on the information that we need to know with regards to diabetic medication and COVID-19.
Okay, so diabetic medication most often can be continued during a bout of COVID. So if you have mild COVID and you're at home, most of the time you can continue your medication unless you are vomiting excessively, you're not keeping down solids, you're only managing to have liquids, you have a lot of abdominal symptoms. Then some of the oral medications will need to be discontinued for this period. For example, your SGLT2 inhibitors, because it can cause issues with diabetic complications like a diabetic ketoacidosis. Your metformin as well, because of the GI side effects of metformin, we would rather discontinue it during this phase. The other oral medications are usually safe to take. Insulin requirements usually go up if the patient has COVID or other intercurrent illnesses, and glucose monitoring needs to be done much more often when a person is sick to actually assess the need for additional requirements of insulin. Very rarely, patients may become hypoglycemic if they're not eating well or if they have very high fevers, and then requirements for insulin may decrease if a patient is on insulin.
And then any link between the insulin and other medication?
So insulin doesn't really interfere with any of your other medications. What does interfere is the medications we use to treat COVID. So patients who are quite sick with COVID, not necessarily those at home, the ones who are hospitalized. And we did see during COVID, because of the burden on hospitals, there were patients being treated on an oxygen at home and with other medications at home. So in a hospitalized setting, but being done at home.
And that wasn't necessarily monitored, the setting at home?
Most of it was monitored by our GPs, and our area GPs were quite good at monitoring these patients with home care. So the medication that we use to treat COVID, the steroids that we give patients with COVID, especially moderate to severe COVID and patients who are hypoxic and requiring oxygen, can interfere with your glucose control as well. And in general, those would increase your requirements for insulin.
I want to just check in with you. The condition of COVID-19 is here to stay. Is there any link between diabetics and, like the flu and the cold? Because now COVID-19 is going to be a condition that's going to be around like the flu. Yeah.
So in general, diabetics are not at increased risk for COVID. Like we said, they're more at increased risk for severe COVID. But however, in general, diabetics who are uncontrolled who have chronically high glucose are at higher risk for getting all sorts of infections, which would then include COVID. So the flu, pneumonias, wounds that get infected and don't heal well, just because of the hypoglycemia, the chronic inflammation, and then patients who have other comorbidities like obesity or cardiovascular disease, high blood pressure, together with the diabetes are at even higher risk because those promote inflammation as well.
Okay. We'll chat more with Dr. Sajida Bulia just after the short break as we expound on post-COVID and diabetics. Back in a moment. Stay with us. Assalamu alaikum wa rahmatullah. Welcome back. A very good day to you. Remember, you can interact with us during our various social pages. And if you're listening to us over the lands and the beautiful seas, please tell your friends and family and colleagues as well. They can catch our YouTube channel after the show has been broadcasted live. It will be uploaded the next day. As well as if you are watching us live, you can do so on www.hilaal.tv. Let's continue with Dr. Sajida, our in-studio specialist, as well as endocrinologist. I wanted to look at quickly around gestational diabetes, because we spoke about type 2, type 1. Then there's, of course, diabetes in children as well as gestational. So does pregnant moms have to worry about COVID still if they are pregnant and there's possibility they could contract COVID-19? And then what about the moms that had presented with gestational diabetes and had COVID as well during the hard lockdown?
Okay, so the risk of getting COVID during pregnancy is the same as the general population. Although the risk of getting severe COVID is again higher in pregnant patients. In patients with gestational diabetes, we've also seen more complications, prolonged hospital stays, higher ICU admissions. And this is usually in patients who have COVID after being diagnosed with gestational diabetes. Those that have COVID before the gestational diabetes diagnosis usually have a milder cause of COVID than these patients who develop gestational diabetes. I remember gestational diabetes is usually diagnosed in the last, late second trimester or the last trimester of pregnancy. So those who had COVID earlier usually less symptomatic as compared to the ones who have been diagnosed with gestational diabetes.
So you're talking earlier as in the early trimester?
So in the early first or second trimester, before the diagnosis of gestational diabetes was made. Just from data, we've seen that those patients who were who had COVID before they became diabetic in pregnancy had a much milder course of COVID than those who were diagnosed with gestational diabetes and then contracted COVID.
Okay, so thankfully we have the gynae's rooms going back to normal. Dads are allowed in the rooms and the labor wards. Just the kiddos are not yet allowed in the wards and stuff. But today's diabetic gestational diabetes pregnant moms, what are the risks as with regards to the vaccine, if they were vaccinated or not, with regards to, still contracting COVID-19?
So I think the risk is still the same as the general population risk, and dependent on the prevalence of COVID at the time in the population.
And of course, things are looking good, much better
Things
now.
are looking much better at the moment. And it's ideally, we would like everyone to be vaccinated before. It does confer some immunity, and it does confer improvement in terms of symptoms. If you do contract COVID after vaccination, much milder course of disease than patients who are unvaccinated.
So let's talk about the COVID-19 vaccine. A lot of people do still want to know that is it safe and effective for diabetes?
So yes, it is. It's safe and effective for all diabetics. And it's actually encouraged in people with diabetes and other comorbidities. Remember, like we said, those comorbidities like diabetes and obesity predispose you to more severe COVID. So having the vaccination gives you that advantage of decreasing the risk of severe COVID if you do contract it later.
Let's talk about children and those kids, pediatric diabetes, because we do know that exists. There are young kids that actually is diagnosed with diabetes. The link between children with diabetes and the vaccine, is that still the same answer with regards to that?
So the same answer. Current South African guidelines still only allow vaccination over the age of 12.
Okay.
But overseas, vaccines have been shown to be safe from as young as 6 months.
Okay. So then we're saying if you're able to go for the COVID-19 vaccine, please do go.
Please do go.
Yeah.
Yes.
Okay. Now there's some people who had allergic reaction to the vaccine, and someone that wrote in that had diabetes. Is there any risk for an allergic reaction?
So the risk for an allergic reaction is not more with diabetes.
Okay.
There is the possibility of an allergic reaction with the COVID vaccine, but patients who have gotten allergic reactions or severe reactions are much fewer than the patients who have been vaccinated. A very small percentage of patients who are vaccinated. And there is always treatment for these reactions.
Okay.
Right? So if you are unsure, I would suggest chatting to your primary care doctor or your physician, your endocrinologist, and looking at your individual risk if you are very worried, and then optimize and stratifying yourself. But in general, for the general population, and even those with diabetes, the vaccines are safe.
So just to make sure that you're crossing your T's and dotting your I's when going to the doctor. If you are having a recurring infection, you don't present with diabetes, you might not have it even in your family. But as said, all of a sudden, post-COVID, there are more diabetics out there. How can you assure yourself, or maybe check in with your doctor if he is not or she's not, pushing to have the glucose test or the fast test to check your diabetes? How can you check in? Do you actually have to say to the doctor, or will they do sort of a routine if you're constantly having, these infections?
Yes, so if you're getting recurrent infections and other symptoms of diabetes, most doctors will screen for diabetes.
Okay.
Every patient who sees the doctor or comes into a casualty usually gets a finger prick glucose at least.
Okay.
A random finger prick glucose, and if that's abnormal, then that prompts testing for diabetes.
Okay.
If that's not normal, if that isn't done, it's not difficult to ask to just chat to your doctor and say that's something you're concerned about and you'd like to get tested for. The quickest screening test, we'd say, is a finger prick glucose, and then based on that, maybe a proper fasting glucose or HbA1c.
Okay.
If you are unsure about it, our chemists offer screening days, our pharmacies. If you're on a plan like Discovery requires health checks, which has glucose as part of the health check, glucose and cholesterol and things like that. And so you can get those checked at your pharmacy, you can get that checked at your local clinic. Every community usually has a screening day where they, and I know the Islamic Medical Association runs these screening days quite often. So you can look out for them in your community and see when the screening day is, show up at the screening day and get checked for diabetes, cholesterol, blood pressure, everything you're concerned about.
Yes, they do, which actually was going to mention that as well. Glucose diary is something that you mentioned in both the segments. What is that, and how do you do a glucose diary?
So a glucose diary is usually just, like I said, patients who are on insulin need to be checking on their glucose regularly with a glucometer. So it's a finger prick glucose that they use to monitor their glucose. And remember,
and this is done all at home?
This is done all at home.
Okay.
So it's like the little glucometer that you see in your doctor's office. Each insulin-dependent diabetic gets a glucometer to keep at home.
Okay.
And they check their insulin. Depending on the type of insulin they're taking, that will determine how often they need to check their glucose. And then the diary is basically just a little book. You get pre-printed diaries, or you can make your own. It's just a means of recording these figures down in a way in which you can notice trends, so that you can notice if you're having a trend toward higher glucose or lower glucose, and you can monitor your control in that way. It gives both the patient and the physician a better idea of what's happening. every day, and you can even note down. So the day you have a high or a low, you can note down what you've eaten, what activity you've done, and then you can notice trends as to what actually affects your glucose. So remember, you see your doctor once every 6 months or once a year, every few months. So it's difficult to make a decision with the patient unless you have that record of what is actually going on at home.
Okay. So stress and sleep and I don't know, in lifestyle, environmental issues, does that affect your diabetes?
So it does. Stress creates, increases hormones in the body that affect glucose control. So stress response increases things like cortisol, increases things like adrenaline, and those affect your glucose control by increasing your glucose levels in your blood. It mobilizes glucose because you think your body is stressed. It thinks you're in this flight and fight response. It mobilizes the glucose so that you have more energy to respond, and then you have hyperglycemia, and you may require additional medication or insulin in order to treat that.
Is that even if somebody's not even on insulin, like on a regular basis?
So even patients who are not on insulin, the stress response, and we sometimes see hyperglycemia, high glucose levels, even in patients who are not diabetic, who will not turn out to be diabetic later, in patients admitted with severe illness to ICU, patients with severe trauma, like car accidents and things like that. We do see the stress response, which is then transient because of these hormones, and may require short-term treatment because of that, but are not diabetic later.
Okay. Thank you so much, Dr. Bulbulia. We will continue our conversation with Dr. Sajida and enlighten you how you can take the road forward if you are diabetic or not, and what you need to do to follow the correct steps, like your glucose diary, your lifestyle, your diet, etc., as well as your stress. Stay with us. We continue our last few minutes just after this short break. Back in a moment. Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome back. Our last few minutes as we wrap up post-COVID and diabetics. Yes, there has been an increase. There's shown some relation between COVID-19 and those suffering from diabetes. So the pancreas has been affected by COVID-19. And to elaborate on what we've been discussing, if you've missed any of that information, please watch our show on our YouTube channel, Hilaal.tv, as well as live stream www.hilaal.tv if you are watching us over the lands and across the beautiful seas. We have Dr. Sajida Bulbulia, specialist physician, as well as endocrinologist in the public sector. Welcome back, Dr. Sajida. So we have to wrap up quickly, inshallah, and take this, inshallah, not just for those suffering from diabetes, but and that had COVID, but beyond as well, those that are not presenting with it at all. I just quickly, before we start off with that, for those that have not done their routine screening, and I know this is something we elaborated a little bit earlier on, they haven't done their routine screening, the diabetics, of course, but now post-COVID, they need to go back to the doctor. They still haven't gone back. Maybe they're just on their regular medication, and they missed out during that screening. What should they do now?
So again, just make an appointment with your doctor.
Okay.
Everyone understands the fear around COVID and the fear around seeking out healthcare, especially if you were well during COVID. So we want to get you back on track to where you at and where you should be. So make the appointment, chat to your doctor about what your fears were, what your fears going forward are, and we will take it from there.
So those that have had COVID, unfortunately, has ended up in hospital, has presented with diabetes for a period of the time that they were sick, and they're doing great. What is their routine checkup for now? Because you said every 6 months or once a year.
So depending on the control of your diabetes, your doctor will bring you back.
And this is
regularly.
Even for those that just presented with diabetes?
So even with those that just present with diabetes during COVID, so those with new diagnosis of diabetes, those with diabetes that require change in medication, so all our diabetic patients, depending on your control of diabetes, depending on what medication you're taking, whether or not you require a change in medication, your doctor will tell you when they need to see you again and how often they need to see you.
Okay.
A well-controlled diabetes, we usually see once every 3 to 6 months. If you are uncontrolled or you require medication change, we may need to see you more often until you are stable. And then those patients, like we said, that were diagnosed with diabetes during COVID and then had a resolution of their diabetes. We're still unsure what the cause was, how exactly this occurred. We are keeping a close eye on them. So if you are one of those patients, I would suggest keeping in contact with your doctor, maybe screening for diabetes every 6 months or yearly, just making sure that we don't know what the cause long term is, whether they will turn out to be diabetic in the future, whether this really was something transient. So we should be monitoring them quite closely. I would assume the same as we monitor our gestational diabetes patients who do have a higher risk of developing type 2 diabetes later on. We do either 6 monthly or annual screening for them. These patients will have to undergo the same thing until we know what's happening.
And then thankfully there are those who never had COVID, hasn't presented with diabetes, has it in their family. What can they do to prevent it?
So prevention of diabetes usually requires healthy lifestyle. So eating a healthy diet, exercising regularly, maintaining a good body weight, just in general looking after yourself well, and that will hopefully prevent diabetes. There are risk factors that we can't modify, like age and gender and family history, but what we can do is lifestyle modification.
Okay, and then kids, and I know this might be a weird question to ask with regards to diabetes and those little ones that do have presented. If they are having possible symptoms and they are getting sick often, should we, prompt our doctor to have a test for them?
So kids do get sick quite often, and that's usually because of transmission at school and playing with friends. And but if they do have other worrying symptoms like the excessive thirst, excessive urination, we do warrant. And if you're very concerned, I would suggest seeing your doctor, addressing your concerns, maybe screening. Kids usually present with what we call type 1 diabetes, which is insulin dependent, and the symptoms there are much more overt than in type 2 diabetes. Having said that, with our worsening lifestyle, worsening westernized diet, sedentary lifestyle, more of our kids are overweight, becoming obese, and presenting with type 2 diabetes, so that is still a possibility if there is a family history. So again, a healthy lifestyle is what we encourage.
Okay. So diet, lifestyle, let's look at the things that we need to include and exclude in our diet when we say, okay, I want to prevent it, or you know what, this is something that's not even presentable in my family history, but I still want to, have what are our good sugars, what are our good foods that what should we not have in our pantries? Just some quick guidelines for us.
So basically we want to avoid your carbohydrates, your starches, bread, rice, pasta, pap, in excessive amounts. If you have a risk of diabetes,
you can't do it every day.
No, you can't do it every day. Okay. So everything in moderation. Islamically, even our Prophet ﷺ taught everything in moderation. So if you eat those things in moderation and you exercise, that's good. The bad things for you are refined carbohydrates, so extra sugars, cold drinks, chocolates and sweets, those kind of things that add to these issues with diet. And then in terms of carbohydrates, like I said, refined carbohydrates. So you choose a healthier carbohydrate, healthier starch. So like a whole wheat bread instead of white bread, brown rice, or whole grain rice. Those kind of things, little tweaks to your diet. And then obviously including more vegetables, good meats, fish, eggs, those kind of things.
And our children, I mean, we want to live a certain lifestyle and we start implementing in our diet and our, changes within the household, but we're still not worried sometimes even with our kids.
Yeah, so I think if you start them from small, if the whole family eats the same things from small, they get used to a healthy diet and lifestyle, an active lifestyle, it's usually easier for them than for those of us that have had poor lifestyle and have to now change and live healthier lifestyle.
Let's quickly, because question that came in with regards to a patient that is diabetic. She's still suffering some upper respiratory issues. She still can't smell and taste, still has a problem with that. A chronic postnasal drip. She struggles chronically with trying to get phlegm loose at the time. She says she has a good diabetic diet. And then she also says that her chest is wheezing and she takes the pump regularly. And this is almost worse after COVID.
Okay, so again, like we said, long COVID is a possibility here.
Okay.
Because our diabetics, even with good control, are more susceptible to getting long COVID.
Mm-hmm.
The lack of smell and taste, even in patients who have recovered quite well, takes a long time to recover. So that may be the issue there. And then the other issue is depending on, we don't know how severe COVID was. Patients who have had severe COVID and have been in hospital can sometimes have scarring from the infection in their lungs.
Okay.
And require things like chest physio and inhaler therapy.
And how can that be seen through x-rays or something?
So that usually be seen through x-rays and lung function tests. I would advise her to see a physician, get a proper physical. Maybe if there are issues, they may refer to a pulmonologist and have those addressed.
So lastly, Dr. Sajida, who would be best to manage your diabetes? If it's controlled, if it's good, do we have to see the specialist, an endocrinologist, or would our GP also suffice?
So if your diabetes is well controlled, your GP will suffice. Usually, your starting point is usually your GP, and hopefully your control is good from the outset, and the GP can manage your diabetes. If there's issues, then they will refer you to either a physician or endocrinologist to manage if there's something they are struggling with. Ultimately, I think the patient is the one who is the biggest control of their management of diabetes. Remember, like I said, you see your doctor once every few months, but monitoring at home, diet, lifestyle, maintaining a good glucose control is the patient's responsibility ultimately.
Thank you so much, Dr. Sajida. So much has been said, and hopefully, inshallah, we pray that all our viewers and your patients follows through with the necessary. And for any more information, I'm sure the IMA is a good website to go to, but your last words.
So just in terms of diabetes, screening, if you are asymptomatic or you have a family history, or if you're worried, is important. Living a healthy lifestyle, good diet, adequate exercise is important to keep yourself healthy, not just from diabetes, to prevent diabetes, but to prevent other issues like hypertension, cardiovascular disease, issues that come with obesity and gaining weight. And then if you are diabetic, looking after yourself, you are the captain of your control, like I said, and then always to have a sick day plan. For when you get sick, what should you do? Sit down and discuss this with your doctor so you have an idea of how much to monitor your glucose, what needs to be adjusted, when to go to hospital if you do get sick.
Great stuff. Thank you so much. Shukran so much to you, and Jazakallah for your time. I hope to chat to you again soon in a better respect where COVID-19 is gone, inshallah. Inshallah. All the best, and assalamu alaikum to you. There you have it, our specialist physician and endocrinologist, Dr. Sajida Bulbulia, based out here in Gauteng in the public sector. Thank you so much for her time. And remember, if you want to catch any of our shows, please do link up with us on our various social pages and connect via our website and email. Next up, we have a list of events and activities hosted by the Islamic Medical Association of South Africa. Take a listen. The Islamic Medical Association is offering membership to all the Muslim students. Our students are the seed nourished by the spiritual and practical growth of the Islamic Medical Association. Join them today and they will help you flourish to your full potential as a qualified health professional. Be part of some of the offers that they have, free membership, networking opportunities, community screening projects, enhancing your leadership skills, nomination for student awards, annual graduation, and various other activities. But you can do that via the Gauteng, Johannesburg, Gauteng, KZN branch and the Western Cape. Be part of the IMA SA membership, and you can visit their website www.sa.co.za. And then the open day for Beit Noor Care Centre will be happening this Saturday on the 5th of November at 10:30, 22 Browns Grove, Sherwood, 16-bed female-only care centre. Viewing will be at 10:30 to 4 p.m. and the official opening at 2:30 p.m. For more information or RSVP 031 209 7838 rather. And then, of course, the IMA has various clinics open, this one in Orlando East, in conjunction with the Jamiyat Ulama of South Africa, at offering various consultations, primary healthcare, adult and child healthcare, sugar, blood pressure screening, family planning, pap smear. Consultation times are Monday to Friday, 8 to 4 p.m. But for more information about the Orlando East Clinic, hosted by the IMA, call 082-842-3290. And then lastly, donate generously to the various projects of the IMA to define the future of the healthcare professionals. And you can do that via the Islamic Medical Association Beit Noor Health Science Bursary Fund. That's it for the IMA, and please visit them on www.imasa.co.za. There you have it. A big thank you, shukran jazilan, to the IMA SA for their activities and the various programs that they have around South Africa to help you, the patient, and the rest of the sick leave. Please go and have your general checkups at your GP, your local GP, and connect with the IMA SA's website to find out where they are out this week. From myself, Gouwah Solomon, wassalamu alaikum. See you next week, same time, same place.